Good afternoon, ladies and gentlemen. Welcome to the Expert Says, an interview series proudly presented by Sanctuary Health. I am Yasmine Lee, President of Malaysian Dental Students Association, and I'm honored to be the host for this interview series. So before we start with this session, I would like to introduce the expert today, Dr. Filippo Cardinali. So he graduated in Dentistry and Dental Prosthesis at the University of Ancona in 1992. He is a member of multiple reputable associations such as Italian Society of Endodontics and American Association of Endodontists, co-author of textbooks like Testo Atlante di Anatomia Endodontica and Manuale di Endodontia, and author of publications on journals of national and international sector. Apart from that, Dr. Filippo is a lecturer in courses on subjects related to isolation of the operative field and endodontics, has participated as a speaker in multiple conferences and courses in Italy and abroad, as well as participated in practicing in a private clinic, concentrating mainly endodontics and restorative. So now let me invite the very talented Dr. Filippo. Hi, Doctor. How are you today?
I'm fine. Thank you. Thank you so much for the invitation. It's a real pleasure for me.
You're welcome.
We are still fighting with the coronavirus here in Italy, but we think positive. Otherwise, we have no perspective for the future. So, and my nature is I always try to think positive. So let's see what happens.
That's good. That's good. Even in Malaysia, we're also trying to fight against the COVID-19. So let's hope that everything goes well as soon as possible. Hopefully. Yeah. So anyways, on behalf of Sanctuary Health, I would love to thank you again for accepting the invitation to be in this session. Entitled The Expert Says, Adapting the New Normal During COVID-19 and Latex Allergy in Dentistry. So just to briefly talk about why we're having this session with you today is because by the end of the day, we would love to understand how COVID-19 affects and changes the dental procedures. And what are the new extensive precautions to protect against COVID-19 and even also other infectious disease, as well as to learn more about latex allergies. So first of all, let's start with the first part. Doctor, what is your view on how the pandemic affects us dentists? In a way, I've actually separated into two parts. So first, let's talk about dental procedures. Then we move on to dental courses and workshop. All right.
So regarding the dental procedures, I think that the pandemic resetted a little bit the organization of a lot of dental offices regarding the management of the patients. And what is important is that the pandemic reinforced the importance on the infection control in our daily practice. So the fact that as a result of this pandemic, that is a tragedy, that probably the infection control increased a lot all around the world in dentistry, I think it's something positive, honestly, and something that has to remain in our practice even when this pandemic will disappear. On the other end, of course, all the procedures are a little bit longer on time. We need more time between patients. We cannot have too many patients on the waiting room. And even working with the protection is quite tiring, especially at the beginning. By the way, I think it's just the way we have to adapt to this situation. And we do protect ourselves and the patients. And especially if you work in, it's the same, but in private practice or even in for the national government, you meet a lot of people. And we work very, very close to the mouth of the patients, many hours per day. So probably It's a little bit tearing for the doctor, especially at the beginning. But the positive point is that the infection control really increased a lot, and this is good not only for this situation, even for the treatment.
I actually like it how you use the word reset, the reset word, because I agree on that perspective where this actually resets everything. So people could know more how important it is to have infection control. So I agree with you on that.
The patients as well. They arrive in the office, they already know everything about the protection, about dentists. Do you use the face shield? Can I have the surgical mask? So they are really informed. Regarding the second part, that is the courses and the workshop, what can I say? I just can share my experience. My agenda for the 2020 was plenty of national and international events that were all canceled, unfortunately. And but even for us, for speaker, it's okay. But I cannot imagine the stress on the organizing, on the organizer, no, of big events or even of and some courses, because they invest time and money on the marketing, on the organization, and so on. So now the education is moved to the web. So I did a lot of webinars, and I did even some congresses online. And this is a very interesting way to interact with colleagues all around the world. By my side, it was really difficult at the beginning because speaking for 1 hour, 1.5 hours, 2 hours, just watching the webcam of the laptop, it's something really quite depressing, honestly. No, it's like speaking in front of a mirror. So, but it is difficult to understand that then there are hundreds of people that are watching you. But what is important during a speech in the Congress is to try to see in the eye of the participant if what are you saying is interesting. So if yes, you can go deeper. If it's boring to the platea, you can change the topic. So this is something that is totally missing through this kind of education. But I do adapt myself to this situation. So, I think honestly that this way to communicate with the participant won't disappear even after when the pandemic will disappear. So definitely I prefer event offline, but it's not possible. I like to, as I told you, I like to watch people during the speech, and I'm really looking forward to come back to this kind of event. But what I have to say is that if a Congress online, it is well organized. So so thumbs up, because are really, really good. For example, I participated as speaker to the IFA Congress, the International Federation of Endodontic Association, and the organization was incredible. So all the setup, there was an interactive screen. So it's like to be not the same, but as close as possible to a real Congress. And they got great numbers, and this experience was incredible. Regarding workshop is totally different, because we still have to find the way to create the same level of interaction with the participant. No, so the participant through the webcam is not easy, and so I think that is something really difficult to manage. This is a challenge to face, of course, and we have to find the way to improve this kind of part of interaction, the workshop with the practical part, and so on.
Yeah, actually coming from an association, we actually organize events as well. And because of this pandemic, everything has to go online. People might think organizing it online is easy, but there's definitely some difficulties coming from a virtual event. So organizing events such as this is quite difficult.
Really difficult.
And as well as the interaction as a speaker, when you're speaking to the laptop or to your camera, it's very odd and weird because there's no interactions from the audience. So definitely. I really respect speakers around the world who does this. Yeah. Okay. Utmost respect for you. Okay, anyways, moving on to the precautionary steps that we're taking. Can you just tell us what are dentists doing and what can dentists do to prevent the transmission of COVID-19?
So, in my humble opinion, speaking about a new precaution to adopt, it is not completely correct because the problem of the infection control is present in our practice for the beginning of our practice, and even how to prevent the cross-infection, the cross-transmission between patients or between doctor and patients, doctor and nurse, and so on. So, in my opinion, this pandemic was like a stress test for under this point of view, no? So, a stress test for the procedure we follow, and it stressed a lot the attention on the aerosol control and on the importance of the rubber dam in our practice. Definitely a way to prevent the diffusion and the transmission from patients to the dentist and vice versa is control the aerosols. Or it is more correct to say to try to control the quality of the aerosol because we produce aerosol during our practice. We cannot avoid it. And so what I do in my practice, and these are the guidelines, it's nothing special, is that the infection control begins very soon in a dental office, no? So, for example, the first step is the mouth rinse with a solution in order to reduce the bacterial load. And now we added peroxide hydrogen 1% or povidone as for the antiviral action. So then in endodontic and restorative, we are lucky. I do mainly endodontics and restorative. We apply the rubber dam. I'm doing that for a long time, honestly. But I know that now there is a new interest on the rubber dam, and I'm really happy for that. And before starting with our handpiece, we have to disinfect the operative field, always using, for example, hypochlorite or chlorhexidine in order to reduce the bacterial load. And even the peroxide hydrogen, now at full concentration, so 6%. And I think that after that, all the aerosol, the spray that impact the operative field and then generate the aerosol, you can understand how the quality of this aerosol is really, really good because there are not bacteria from the mouth, from saliva, and so on. Then, so if you add that we are working with a FFP2 mask with a face shield, so I think it's, I'm not saying it's impossible, the transmission, but it's really difficult. And as a matter of fact, in Italy, at least in Italy, very few dentists get infected during the practice. So probably we can say that the dental office, especially regarding resto and endo, is a safe zone for patients and doctor. And regarding the control of the aerosol, it helps a lot, even the management of the work at the office, no? Because, for example, if you are working in that way, there are a lot of studies that are not new, are 20 years old back, that say that at 1 meter from the mouth of the patient, basically, there is no more risk for contamination. So it means that if your secretary is knocking your door to give a communication, you are late, there is your son at the phone, and so on. So there is no risk she get infected. So I think this is really important.
I am actually quite surprised to hear that it is safe for the dentist in Italy Because from what I know, that this dentistry is quite a high risk for the transmission of disease of COVID. So when you say it's safe, I'm actually quite surprised.
No, I mean, we are considered a high risk category. So that's even the OMS said don't go to dentists during the pandemic. But if you think well, according with all the protection, we do the triage before the patients come into the office. We take the temperature, and then we protect the patients. We do the mouth rinse, and we apply the rubber dam. The concept is we are in a high risk category, but we do have all the instruments to reduce the risk. And I told you, as a matter of fact, in Italy, if you consider the percentage of infected people among the high risk category, so the dentists are at the lower level. So it means that probably we are able to control with a proper triage, with a proper procedure, this problem.
Interesting, very interesting. So since Dr. Filippo advised patients to rinse their mouth before the treatment, in other words, the aerosol produced afterwards wouldn't be infectious. Would you still use filter or high volume suction to reduce the aerosol in the room?
Yes, of course. So basically, once the rubber dam is on, we disinfect the operative field, and we start working with the handpiece with a 2 high volume suction. And so it's we are doing the best we can. I mean, so we can what we can do more to not treat the patients probably. So, but we have to work. So it's
yeah, true. Anyway, since we talked about rubber dam, I believe that nowadays, as what you say, the interest for rubber dam has increased. So this is actually a very good perspective for the pandemic because it encourages people to use rubber dam. But what are the other steps that we can do to protect ourselves as a dentist, or to protect the dental assistants, to protect the patient and the surrounding as well?
So we wear all the protection. So we have a sterilized cap, and it is really important, in my opinion, the face shield to protect your eyes, your mouth. And even it is really important. So the disinfection of the chair after patients is something that is belong to us for a long time. No, so to work with a sterile handpiece, sterile material, and so on. But what is important is to make that between the patients there is at least 20 minutes. In these 20 minutes, the nurse is cleaning the room, but the windows are open in order to create an exchange of air. And I think this is a really important point. There are even some systems to purify the air, but the efficiency is not so clear, honestly speaking. So this is what we do, and we try to work on group. So there is same doctor, same nurse for that patients in order to not, so the nurse has to do everything. So we try to avoid that the nurse moves to a surgery to another one. Okay, so I go into the room with the nurse, I work with all the protection, and I stay until the end of the procedure. Then after the procedure, we remove of the protection, me, the nurse, and there is another person in charge to clean the office, of course. And then we try to avoid that a nurse move into another surgery to take an instrument or to say something. We try to work in a close environment.
something new for me. I've seldom heard people talking about this control of movement of the nurses, which is actually a very good point, so that you can decrease the transmission. Yeah.
Okay.
Next, we have heard about the vaccine being developed. So if it actually works, this vaccine, do you think that dentists around the world will still continue the extra precautionary steps?
So honestly, I hope so, because the vaccine is really important, even to work a little bit more relaxed, of course. So, but I think that, as I told you at the beginning, the positive point of this pandemic is that the infection control is increased a lot. And infection control is important not only to avoid the transmission of this pandemic, but it is important for the quality of the endodontic and restorative treatment. So it's important even for the patients, for the outcome of the therapy. And probably in future, we don't know, probably we will face again a similar problem, no? So we are ready now from the beginning to be protected, and so that's why I hope that the only change is that we can work with less fear to get infected, with less probably you can reduce a little bit the time between patients, but I hope that the infection control remain at this level because it's really, really good.
I have a feeling that Dr. Filippo thinks that rubber dam is a very essential thing in the treatment.
It is the most important, honestly.
Tell me about it.
You know that this is my favorite topic. I wrote article, book, and I hold hands-on courses on rubber dam. You can find everything. If you type right on Google Cardinali rubber dam, you can find I think something that I did in the past. So the rubber dam is really important because so in my opinion it is not possible to work without, because so this is a really important point, the infection control. But honestly, before the pandemic was always at the end of the advantages of the application of the rubber dam. So the big advantage is that the rubber dam is our friend. So meets some clinical necessity we have during work. So our work depends on vision, depends on the access to the operative area. So with the rubber dam, we know that we can improve the vision, we can improve the access. And of course, every time you can see better, you can access to the tooth better with your tool. The result is that you can work better. And of course, you work with less stress. Sometimes I cannot apply the rubber dam and I get really nervous, honestly, because everything is more tearing, no? So it's from the position of work, from you work, you see the tongue is moving and you see the suction is, so it's a mess in my opinion. And then we have even a scientific support. So it's something that is comfortable for us. It's something that is comfortable for the patients because we created the so-called the effect of the patients is that you are treating something outside the mouth, because you are not more placing your hands, your mirror, the suction inside the mouth. So this is really important. Even in patients, they have a gag reflex. So impossible to treat patients with gag reflex without the rubber dam, in my opinion. And of course, regarding endo, you prevent the infection of the root canal system from bacteria rising from the oral mouth. So you are increasing the success rate, you are increasing the power of the cleaning, of the irrigation, just applying a very cheap tool. Probably is the cheaper tool we have in our dental office. So, and And the result is that the outcome of the therapy is better. And the same is for the restorative. So I honestly, I don't think there is any kind of reason to not to use the rubber dam. Patients is not asking you to rinse. Is not the patients cannot speak with you. Sometimes this is an advantage. So it's I can see just a positive aspect about the rubber dam.
I've actually heard of a joke before, actually from Prof. Massimo. He said that the patient's husband actually asked Prof if where to get a rubber dam because the patient is too noisy at home. So I thought it was a good joke to share with you. But yeah, rubber dam is actually a very beneficial thing because not only it prevents the transmission of the disease for infection control, but it can also increase the success rate for preventing contamination of the canal, better visualization as what you have said. So I think, rubber dam is a very good thing to do in your procedures. However, I have heard that sometimes people complain that rubber dam application might be a little bit too uncomfortable for the patient. So what do you think about that, doctor?
So it is important first to understand the benefit of the rubber dam, and this is one of the focus of my hands-on course. And then it is important to plan the application of the rubber dam because it is important, really important, to motivate the patients. So if you share with the patients your knowledge about the rubber dam, or basically the concept, okay, if I'm using this the rubber dam, the treatment will be a better treatment, even if the ends are always the same. I'm always working with the same loops, with the microscope, and even the price is the same. So it is difficult to find the patients that say, oh, it's okay, doctor, and it is not important for me. I want to pay the same for a not so good job. So this is the first point. But then when we apply the rubber dam, we cannot spend too much time, because if you spend 5 minutes, 10 minutes, and the clamp jump out from the mouth, so the patients say, it's okay, doctor, but if it is so difficult, we can do without. So that's why it is really important to plan the isolation and try to intercept all the difficulties arising from the application of the dam in that situation before, in order that when you go to apply the rubber dam, so it's just like a single shot, and in 15 seconds, 30 seconds for a single isolation, or 60 seconds for in a multiple isolation, everything is done. Mm-hmm. And of course, according with the patients and with the treatment, you can choose among 4 application techniques. So there is a strategy, of course, but it's really simple to learn. It's nothing impossible, I mean.
I think I definitely need to practice in how to apply rubber dam faster and more painless, so that the patients would be more willing to accept rubber dams later on. But it is a good strategy to tell them how important it is, and it actually costs the same price with or without rubber dam. So why not? Yeah.
Yes. Okay. On the other end, the rubber dam should be something that is in our protocol. You're not asking the permit to the patients to do the anesthesia, right? Mm-hmm. So why you should ask the permit to place the rubber dam? So it's part of the procedure. So now I'm working for 28 years, so probably as soon as I see the patients, I can immediately understand if he's anxious or if it's okay. Is a patient, I know that, so I know it's not a problem. But immediately you understand if you have to explain what the rubber dam is, especially at the first use, or if sometimes you have to apply the rubber dam without saying nothing. So it's part of the procedure, full stop.
That is something new for me as well, because I think it's a very good thing for us to actually see it as part of the treatment instead of an extra thing to do. So it's like you're expected to have a rubber dam on. Okay, that is a very good advice for me as well. Because for me, like it's always like an extra step. So if patient is not very comfortable for it, I might not choose to do it. But if we see a different point of view, it might actually be better. Moving on to the next section of this session, latex allergy. So there are actually latex dental dams and non-latex dental dams in the market, I believe, to cater for those who are allergic to latex. So, Dr. Filippo, what is your opinion about latex allergy?
So, fortunately, the dental allergy is not so common, but is something really important that we cannot underestimate. So, we have to pay attention. So, we know that generally the allergy to the rubber latex is detected after some exposition to the material. So often the patient already knows about its allergy when he comes in our office for the first time, and generally something the first thing that say, I'm allergic to latex, so please pay attention. But in any case, it's something that we have to investigate if it's a new patient during the anamnesis, no? So we know that most of the allergic people belong to category that are strict contact with the latex. So employed on factory that are working with the rubber, or even nurse and doctors. So regarding the allergic reaction, we know that there are three types of reaction. The first one is not an immunological reaction, is an irritative dermatitis, and is more linked to the powder we can find on the gloves, we can find on the rubber dam sheet. That's why there are gloves and rubber dam sheet powder free. So the problem is not the latex, is the powder, are the components used during the production of the gloves or of the rubber dam sheet. The second type of reaction is a type 4 hypersensitivity. This is an immunological response, but is late and a localized reaction. So it means it is not on the chair while you are working. So after 48, 96 hours, the patients come back saying, okay, I have like erythema or bubbles similar to irritative dermatitis. So it's something that is not immediately on the chair. And then there is the third one that is the most tragic, is the type 1 hypersensitivity. Fortunately, is rare and is an immediate reaction. So it's on the chair, unfortunately, and is modulated by IgE. So its symptom can range from just a local sign or laryngeal swelling, palpitation, bronchospasm, or you can have a reduction on blood pressure until the most tragic, that is the anaphylaxis. Okay. So in this kind of patients, we do follow, of course, latex-free procedures. So we do use latex-free gloves. We do use latex-free dam, definitely. And this is the only difference we have to follow. Please consider that in the anamnesis, the people that got a surgery in the hospital, 2 surgery in the first year of life, are considered at risk to develop a latex allergy. What I try to do is to treat the patients as a first of the day, because some years ago, one of them, when arrived in the office, they started to have some respiratory difficulty, but just in the waiting room, no, because when you remove gloves, there is powder in the hair, and on the powder you can have latex allergen. So probably, I don't know if it was something real or something more emotive from the patients, but my suggestion is try to treat as a first appointment. So the office is completely latex free from the day before. So it's okay and no problem. And honestly speaking, working with rubber dam gloves is not so comfortable to me. And even with latex-free rubber dam in the past was not easy. But now there is a very interesting latex dam-free, and this is the purple one from the company Sanctuary, that you cannot understand, that honestly speaking, you cannot understand if the sheet is with latex or without latex. So there is the same elasticity, the same resilience on the sheet. This is something really important for a proper application. So I think that now in my practice, it remains only the problem of the gloves. And honestly speaking, in the past, as was so difficult to me to work with latex-free rubber dam, what happened is, okay, I buy the box latex-free, and then the box is is away from me, and at the next use, it was expired always. Now there is no more this problem because this one is really good. So I have the box, and then I can use even during the normal practice. So because the properties are really, really good and really, really close to the normal sheet. So it's a good point.
So like, as what you said from the past, the non-latex rubber dam are actually not as good as the latex rubber dam, is it?
Yes, because I don't know, it was elastomer. So when you the risk is during the application to tear too much the sheet, and then the hole you created remains too big. So with not good leakage control. Now that this problem there is not anymore, thanks to this new rubber dam latex free. So it's really similar. The resilience is a characteristic, and the elasticity as well is a characteristic really important. So there's something that we have to know about the rubber dam in order to use properly this tool. So every time the elasticity is not good, you risk to get a scratch of the sheet. And when the resilience is not good, the risk is that after the stress for the application of the dam around the tooth, the sheet doesn't come back to the original shape, but is not. So there is a lot of space between the tooth and the edge of the hole. So you have leakage that then you have to control. So you have a problem that you can control, but the less problem you have to control, the better it is for your practice. So that's why for me it is really important nowadays when it comes to patients with latex allergy to have this kind of rubber dam that is basically similar on properties to the one with latex.
Since like the non-latex rubber dams now are pretty similar to the latex rubber dam, should we just purchase non-latex rubber dam like for everything? Or do you still recommend to purchase latex and then some amount of non-latex rubber dams?
Now as soon as this rubber dam arrived, I can use this rubber dam even in patients without allergy because the properties are the same. So it depends even on the color you like. This is a very good purple. So if you like to work with the purple, so this is the rubber dam you have to use. So it's So it's, for me, it's the same. Now there is no more difference between a latex or non-latex. So it's I always try to not to I always try to not make that the rubber dam get expired, no? Because because a part of control you can have from authority, but when it is expired, it is not dangerous, the rubber dam, but it losing the resistance to the tearing and the resistance, so it scratch easily, and you cannot have in your office something that is expired. So in the past, the risk was to use 2 sheet out 36 for one patient, one per year. So, and the other 34 sheet you discharge it because they get expired. So now there is no more this problem, and under the ergonomical point of view is good for the office.
Yeah, it is. Anyways, back to the latex allergy. Can you teach us how to test if a patient has allergies or not?
So if there is during the anamnesis, a suspect of latex allergy, I'm not crazy that I do test by myself in my office, but I ask the patients to go to a laboratory for to test if the allergy is really present or not. Of course, if happens that I apply the rubber dam and dermatitis around the mouth appear, so I immediately remove the rubber dam. I try to put some cream on the patients on the skin. I mean, but this is a dermatitis, so it's nothing dangerous for the office. No, it's something that will disappear very, very quickly. And in this case, so I sign on that the patient has to be treated with a latex-free rubber dam, and then we use latex-free gloves, of course. Or there are even some shield to interpone between patients and the latex rubber dam sheet, but it is better to use latex-free rubber dam, honestly.
Yeah, to avoid all the trouble. So, anyways, if we have a patient who is allergic to latex, do you have any advice on how to communicate with the patient so that we can convince them to accept the usage of rubber dam? Because even when we have told them that it's latex-free, they might be worried that they will still have allergies. So is there any advice that you can give us in communication with these kind of patients?
No, because you have, of course, you have to speak with the patients. You have to communicate to the patients that according with this problem, we are following latex-free procedures. So all latex-free, from gloves to the rubber dam as well. So any kind of problem during the treatment. So it's, but generally the patients, as I told you, already knows about the allergy, and they pay a lot of attention, and they can, they had contact with latex. Probably they are in contact with latex every day. So you have just to speak. Communication with the patients is important. You have to try to relax the patients, but then you have to explain that following latex-free procedure, there is any kind of problem. And in any case, we hope you have the emergency kit, but we hope to not use, of course. Okay.
So basically, to reassure the patient that everything's going to be all right.
Yeah.
If worst case scenario, something goes wrong, we still have, a backup emergency kit.
There is a procedure. You have you have to do. You have drugs to give to the patients, and then you have to call the emergency hospital. And it starts a management, and there is a team in the office. So everything get locked, from secretary that start calling the hospital, and then we have the mask to breathe air. We do the injection with the drugs, but fortunately, it doesn't happen. So
Yes, the
it's really
percentage is
rare
quite low lah.
Hmm?
The percentage of having patients with allergies to latex is quite low. Is it?
Yeah.
Okay. Anyways, since rubber dam is so important, what other treatments do you encourage to use rubber dam other than endodontics treatment?
Yeah, it is really important for endodontics treatment, and but not only for endodontics treatment, even for restorative treatment, because we know that thanks to the use of the rubber dam, you have a better interface between the tooth and the adhesive restoration. So the degradation of this layer, the hybrid layer over the time is lower. So every time you go for an adhesive cementation of veneer, of crown, of an indirect restoration, so every time there is the word adhesive, you have to think that you should apply the rubber dam in order to get all the benefit of the material you are using, because we know for a long time that this material you cannot work with this material in a contaminated operative field. And another important point, and this is another big advantage of the rubber dam, is that it is true if you are working in an upper mouth, okay, I can using cotton roll and a double suction, and it's okay. It is easy that you can have a dry operative field, but you cannot control the intraoral humidity of the mouth. So if you put a mirror, even if you have a suction and so on, you can see that there is a lot of humidity. And the only way to control the intraoral humidity is the application of the rubber dam. So it's a lot of advantages just using this very cheap tool. So honestly, I cannot understand how it is possible to not use this tool.
Yeah, it benefits so much. Why not use a rubber dam? Exactly. Okay, I guess that's the end of our interview today. So, do you have any advice for the fresh graduates who have just finished their course?
Yes, I have. So you are at the beginning of your practice, so you should be plenty of energy, enthusiasm, and nothing is easy to do, especially without passion. So you need passion. You have to learn from your mistakes. So I'm still learning from mine after 28 years of practice. And this is a very good way to increase your skill day by day. So you have to be critics with your work. You always have to think, this is a good one, but probably I could do better. And I try to do it in the next patients. And there are no magic poison, no shortcuts in our practice. There are just, it's a matter of time to increase the skill, to understand what you have to do. And then there are rational procedures to follow that are based on scientific literature. And today, thanks to the web, it's really easy to have access to right information. No, if I think when I was graduated, the internet was not didn't exist. So for us, the only way was to buy a book or to speak with older colleague to understand what is right or not. It is true that in the web sometimes you can find some shortcuts, but I think that it's easy to understand what is right to do or what it is not right to do in order to carry out a good treatment. It takes time, but you are young and plenty of time. In my personal experience, this is what I'm sharing with you. You see that probably you start working without a rubber dam, but then when you are increasing the level of your restorative and endodontic treatment, you need the rubber dam. And the rubber dam is a real game changer in terms of quality of restorative and endo treatment. And as soon as I started using routinely the rubber dam, the average quality of my treatment raised up immediately. So it is quite normal at the beginning of the practice to hate the rubber dam because it looks like something that is not useful, that is very difficult to apply. But please believe me, the rubber dam is one of your best friends you have in your practice. And so I want to say hello to all the listeners of this interview. I really thank you. And I want to read you a few sentences of a book that I dedicated to the rubber dam to resume this concept.
Sure,
So the dam is not meant to be used by a small privileged elite of colleagues. It represents a simple and affordable solution for the practitioner who want to perform their job according to correct biological and ethical guidelines. Having a clear view means less stress, makes the job easier, and simplify the management of several factors as saliva and soft tissue. This is all about a different professional approach. To isolate means to respect one's work and prolong one's professional life. When we use a dam, we are caring about the patients, but even more about ourselves. This is what I really think. So,
wow. Just wow. Such an inspiration. You're truly an inspiration, Dr. Filippo.
Thank you.
Yeah. So, anyways, thank you very much. It is such a pleasure to meet and talk to you like that. And definitely, I have learned so much from you. And I believe that everyone watching this video would learn a lot too. So, thank you very much and have a wonderful day.
Thank you so much. Bye-bye. Best wishes. Bye.
Bye.